We are not building an artificial intelligence per se. What we have in this project is we have the people and the expertise around the table, so to speak, to understand what artificial intelligence can be, because we are trying to also understand what biological intelligence can be. So we can make those cross-references. We have computer scientists, we have high-performance computers, we have basically also people who understand what consciousness is and research on that. So this project can help with the discussion. It will be increasingly important for society to be able to have some sort of an assessment, AI assessment, that can say, well, this is what happens here. This is a classification of artificial intelligence. One of the problems that we have, and this is for ethical and moral reasons, but also one of the problems we'll have if we are deploying AI systems or we're trying to bring that on the market, we cannot make the mistake that happened with genetically modified organisms, where this conversation with society did not really happen at the level it needed to be, and consequently was largely rejected. So we are in a situation where we have to seek that conversation, and we have to be able to help make AI transparent. And I believe one of the trajectories this project can be on is to be helpful in this way and help to decode, to understand our intelligence, human intelligence, but also artificial intelligence, and make those connections. I think that can be a major contribution.
So, Mike Oliver, what do you think about the future's opportunities and challenges?
So I think the opportunities are clear and the challenges are also clear. What is currently a difficult situation is that many people most people actually have a completely exaggerated view of what AI, for example, can do today. And I would even challenge to say that DeepMind has some guilt in that. So, for example, if you talk about self-driving cars, the term itself is a misnomer. These cars are remote controlled. They rely on a huge infrastructure that is built around them, and if this infrastructure is switched off, the cars will simply not drive. There were autonomous cars developed in the early 90s with very simple methods by VW and Mercedes, for example, and they actually drove the Rallye Paris-Dakar at that time. But of course, the problem is if you put these cars into a normal traffic scene, they will basically fail at that time like they would fail today. And the reason is that the technology is good wherever we are good, and it's also bad wherever we are bad. We are not yet in a situation where the sensing technology in a car will allow us to basically fix the holes that we have. For example, if you think about a driving scene at night, it's raining, and maybe there's a little bit of snow coming down. It's extremely difficult for us because we get this flow field effect from the snowflakes, and basically that kills almost all of the visual-based free driving, road area recognition systems, and other sensors fail as well. And this is a huge challenge, and I don't really see that this will come, I'm sure, but we are nowhere near that. And calibrating the expectations of the public and the policymakers with what is actually possible, that is currently a big problem that we have. On the other hand, it's an opportunity because people think about the problems long before we have the capabilities, and maybe that's a chance to get the regulations up to a point where they're guiding.
Definitely, if we were able, which I hope, to install this medical informatics platform, let's say in 100 university hospital in Europe, first to share information and make good research. Then when the AI tool that will have proved useful and reliable for improving diagnostic and treatment decision, which is already the case in the field of cancer. IBM Watson has been developed for that for decades. There's now a hospital in the US where every single patient with cancer is submitted to IBM Watson to take decision of the most appropriate treatment. So this could well happen. This will happen. This will happen in medicine and in medicine of brain disease in the future. It will need connection, physical, IT connection, between the electronic medical data of the patient that stay in hospital for the reason I told you, and a bigger system, necessarily centralized, that will be able to apply those AI operation. And that's where I see a great potential for the MIT. That could be the system that eventually will deliver that facility. That's one objective, long term, but I think imagine yourself that tomorrow you are facing a very challenging disease, and people offer you to submit your medical file to a system that proves that it will increase your chance of being cured by 30% or 40%, because that will come with those kind of figures. You will not hesitate 1 second. Of course, provided that the data will not be transmitted to the public, to Google, or to your medical insurance. But that's obvious. This is something that we need to secure.
So, Ginevra, you are actually working with the robot and the people, and the robot is trying to understand the emotion of a person, constantly doing machine learning and algorithms. So how do you think we should work with this to make it valuable? What is the most important thing when we have a robot interacting with our kids at school, or with us ourselves or our relatives in the hospital?
Well, you mentioned at the beginning that interacting with the final users is very important. So we need to think who are the humans who will work or interact with robots. So these robots will need to work in very specific scenarios. You mentioned education, and perhaps some things in a school environment are different and need to be taken into account that wouldn't otherwise be investigated in another context. We know that people interact differently with robots, and they also interact differently with different robots that look more human-like, or others which are more mechanical looking. So can we think of using a same data set to train algorithms that can be used in a larger context? This is still but there are a lot of things that we must consider when we are thinking about possible ethical issues arising from the deployment of AI systems or robots in the real world. And we mentioned the users, and these users need to be informed, need to know what to expect from the robots they will interact with. Something that I would like to mention is also the possibility of a failure. A robot might stop working, or might work in a way that is not appropriate to the context of the situation, might say something that is wrong, or we might have a tutor that becomes too bossy. So what happens when we have a failure in a social interaction, and if we deal with the vulnerable populations? And here I connect with your example, social bonding. Is it always good that people bond, establish a connection with robots, or are there cases where perhaps this may trigger some negative effects? And maybe I can go on now. We all mentioned about ethics, and we talked about transparency earlier, and that's also quite important for robots too. There's supposed to be a link between transparency of a robot to its users and trust of users towards the robot. So is the robot capable of displaying to people what it has learned about them? So that's quite crucial. There are also other issues. Control. Should a robot always be in charge? When should the robot hand over control to the human? How do we decide? Maybe we need some machine learning that can help us there. How do we deal with that? That's also relevant. Privacy, also quite widely discussed today. So robots will eventually access information about us. So who owns this information? And how do we go about the responsibility if something goes wrong? So there was some news in the last few weeks about first fatal crash involving a pedestrian and Uber, autonomous driving car. So who's responsible there? What do we do about it? Should we stop testing these new technologies? And who is responsible for regulating companies, policymakers? That's also important for all of us.
So yeah, I can continue on what you said there. So it's interesting. I mean, it's horrible when someone gets killed in traffic, but for some reason we have accepted the fact that we keep killing each other in traffic to an absolutely enormous rate. Still in countries like Switzerland and Sweden, and I mean, if you go to certain other countries, it's even worse. For some reason, we accept that. That's, I mean, because we need to use a car to go to work or wherever you go. But it's interesting. I'm utterly convinced if I get to live for another 30 years, I hope I will do that, and I will then look back and think about what we kept doing right now. We sit in a chunk of steel which weighs a ton or something, and then we go about in 100 kilometers per hour, and we're just a couple of meters from each other, and we're relying on our limited capabilities of sensing such a complicated environment. And we've seen that keeps failing all the time. But there I see a clear possibility, based on what I've seen at least, in terms of using this. But this means we need to go back and reevaluate quite a lot of things, as you said, not only these things, but many more things. So that's a complicated question, but it's important, I think, to just look at the situation right now, how much that costs, if we stay with that particular example.
So basically, we have a question from the gentleman, and we're going to go to the lady here.
I would like to follow up when it was talk about ethics and so on like that. For instance, you all know a US company called Boston Dynamics, and they have a big dog robot and so on like that. So you said that, Dr. Gavassi, we are far away when it comes to AI and robots, but isn't there a risk when there's like the arms companies and so on like that, they develop something, so we already have these type of replicants among us?
So I think we have to clearly distinguish a number of things. So big dog, for example, it looks like an animal would walk, but it works with different principles. Now, it doesn't make it less dangerous, and we should also be careful that just because we don't have a certain technology yet doesn't mean that the technology that we now have isn't dangerous. And you don't have to actually use the big dog as an example. If you go to YouTube and you Google slaughter bots, then you will find a rather shocking but quite possible scenario where you lose these little mini drones that you can buy in every toy store for 30 francs, and where they demonstrate how you could use it to assassinate people by basically having a payload of explosive and targeting at somebody's forehead. So the technology that we can build today can make for some very formidable and powerful weapons. And we shouldn't mix everything that is new technology into the same basket. Clearly a thing like Big Dog is, it looks frightening, but there is a certain reason why the US military, for example, has decided not to invest further in that technology, but rather the company was sold to Japan. However, there is in big data, as we've seen it with the Cambridge Analytica scandal, there is with drone technology, there's a lot of technologies out there that, if not carefully regulated and without ethical standards, can basically evolve into things that are akin to chemical or biological warfare, in the sense that they kill basically without too much distinction, because they're just running amok. And this is a real problem that we have to face and work with.
How would you say that this project has value for every of us in this room.
You have to understand that hundreds of thousands of scientists are doing brain research for decades. And as Mark Oliver has pointed out, one of the objectives of the HPP is trying to coordinate better at least part of this research and create that big synergy between 1,000 scientists on this topic. And possibly we will need to merge this with many other consortia to get all this science converging to a more ambitious goal and avoiding redundancy, permanent redundancy, and a lot of useless research that is being done because of this lack of coordination. I think this is one of the main objectives of the HPP, this coordination, and trying to avoid wasting so much money and effort in brain research because it's being dispersed all over the world.
I think that there are two aspects that come together. One is the Human Brain Project tries to develop what we call enabling technologies. And you would like to have the whole world join in putting the pieces together and putting the data together. And this is what the different platforms of the Human Brain Project are about. So I told you that we have this very crude simulation here. And of course, the question is, how do you know that it's right? Well, it's the other way around. We know that it's wrong. Yeah, we start with the knowledge that this is wrong. And every scientist will tell you this good old quote, every model is wrong, but some are useful. And the usefulness comes from the fact that we can compare it with other measurements. And also, maybe in the globe metaphor, this is more obvious, it is about the consistency. Same in brain research. There are some regions which are extremely well studied, visual cortex, for example, because people would like to understand object recognition. So everybody's been looking into that for 50 years. And there are other regions, brainstem, which is very important for spinal cord repair, for example. Very, very few people have looked into this. And of course, if we have one data set here and zillions there, we know exactly how to evaluate the results that we are getting. So we have a pretty good idea about the state of badness of the models that we have. But the goal is to have an idea of where do we already know things and where do we have to do new experiments instead of, like Philippe said, redoing the same thing over and over again, which neuroscience got into a habit of for the last 50 years.
So will we be able in the short future to go in and say, okay, I want to find this, and then look at all the information we have and pinpoint down? So what would be the challenge for us to get there?
The challenge for that is twofold. One is a technological challenge. This is what the HPP can solve. And there's a neuroinformatics platform and the medical informatics platform that solve it. And then there's a cultural challenge of scientists actually giving away the data and preparing it in such a way that it can be put into these types of databases, because data is basically a treasure for a scientist because it's future publications. And people are very reluctant to share because they think maybe there is a paper that suddenly somebody puts out there, a publication, which I could have done. So that's the harder challenge that the HPP can not so easily solve.
Indeed, if we look at the real breakthrough in clinical neuroscience for the last 40 years, there has been deep brain stimulation in Parkinson's disease. That has been important, and that led to some other application of neuromodulation. There has been, over the last 10 years, real progress in multiple sclerosis, but it came from progress in immunology. Most of the new treatments that are really effective and change the fate of multiple sclerosis came from discovery not made in neuroscience, made in immunology. And more recently in stroke, by applying old recipe, dissolving the clot, they did in cardiology 20 years earlier, and more recently, very effectively using stent to just remove physically the clot. So, it doesn't take a lot of artificial intelligence to understand there is a clot, I want to remove it, and if I do it properly, it will save some brains, and it does. And there's not much else in the last 30 years. So when you think up the millions and millions of publications in neurobiology, in molecular genetic, for the moment, almost none of it translated into progress in medical care. There have been so many examples of very effective treatment in rodents, in mouse, in rats, showing that this drug protects the brain very effectively, that this drug is slowing a process that is like Alzheimer's disease in human or other neurodegeneration. They all fail in human. So there is a gap. There is a knowledge gap, and maybe more than a knowledge gap, I think there is a gap in the way the scientists have the pretension that they understand something extremely complex and believe they can tackle it too easily. So I'm not that optimistic that the Human Brain Project in the next 5 years will change this. My hope, it will just bring more and more data that will help future progress and just accelerate the progress. But we will have to be very patient.